Pterygiums are very common. It's a growth on the outside of the eye that develops. Usually people who are out in the sun too much, exposed to a lot of ultraviolet light, wind, dry air, dust, smoke, things like that. Any kind of chronic irritation will cause the skin of the eye to overgrow, and that's what becomes a pterygium. Pterygiums can get real red and irritating. If they get too big, they can start to affect the vision because it starts to distort the cornea and can affect the vision. For most patients, if they're good about wearing sunglasses to protect the eye, using teardrops to keep the eye moist, they can usually control it, keep it from getting too red and too irritated and too bothersome. Won't make it go away, but it'll often keep it from growing to the point where it threatens the vision. If it's red a lot or itchy a lot, we can give you medications to reduce some of that. Again, they don't make it go away, but they can control the symptoms. If the pterygium is really bothering you, or it's getting to the point where the vision is threatened, we can take it off. One of the problems with taking the pterygium off is they can grow back, but the way we do it now, what I usually recommend doing, and almost always do, is what's called a conjunctival graft. What that means is we take the pterygium off and we take a little bit of skin from underneath the eyelid and use that to patch the area where we took the pterygium off from. That puts some new healthy tissue there and blocks the pterygium from coming back. So with that, the chance of a pterygium coming back is about 5%. If you're good about protecting the eye, usually that takes care of it. Without a graft of some sort, the chance of the pterygium coming back can be as high as 30 to 50%. So I definitely recommend doing with a graft in most patients. One other option is called an amniotic graft. What that is we can get a piece of donor tissue from amniotic membrane, from a placenta. So this is young, healthy, basically baby tissue that we can use to patch the area that we take the pterygium off from. And this is another way of reducing the chance of it coming back. We'll sometimes do that if a patient doesn't have enough of their own conjunctiva to graft, or if the pterygium is too big or there's too many of them. So this is another option that we can use to reduce the chance of the pterygium growing back. The way we do the surgery now, we can usually do it with what's called tissue glue, which is a natural glue that we use to stick the graft in place. So usually there's no stitches. We can numb the eye up, which is a little local anesthetic. We do patch the eye for the first day. The next day, the eye's going to be a little red and scratchy. I usually warn patients it looks worse before it looks better, but it's usually just a little minor irritation. It's not painful. That can last for a week or two. You'll be on some drops and ointments for the first few weeks to help with that. Most patients are off for a week or so after the surgery just because it looks kind of red and swollen. But again, like cataract surgery and other procedures, you can be back doing most normal things, usually within a day or two pretty well.